Welcome back to the NHSC site application process. Today, we're going to talk about sliding fee discount policy. As always, everything that we talk about today can be found at the Health Resources and Service Administration website under the National Health Service Corp section. And everything I reference today can be found in the NHSC site reference guide. So please read it before you start creating your application. So we've talked about the sliding fee discount program policy. So the sliding fee discount program should be based on written policies applied uniformly to all patients. So this is including both uninsured and underinsured, and supported by operating procedures. So at a minimum, your policy should address the following areas. So it should include patient eligibility, which includes frequency of patient eligibility reevaluation, income definition, and family size definition. A second point should be that documentation and verification requirements to determine patient eligibility. So you should have some documentation and discuss that within your policy of how you verify to determine patient eligibility. How does your site advertise the sliding fee discount program to the patient population to increase access to care? Do you have it on your website? You most likely should. Do you have it throughout your hospital or site? You probably should. So including how you advertise it within your organization within that policy. And then an explanation of the nominal charge, including the site's policies and how it establishes and collects nominal charge. So what constitutes refusal to pay, things of that nature, just an explanation of the nominal charge if your organization site has one. And a description of its collection policies for outstanding debt. So having a collections policy, you can upload that too as well with the sliding fee discount policy when you're creating your application, but talking about it, especially in the policy, is necessary. And then we're moving on to the sliding fee discount program patient application. So your sliding fee discount program application should be limited again to just that family size and income questions. Additional questions that should not be included in the application include those related to a patient's social security number, citizenship status, housing status, or marital status. Sites must not also use credit checks, payment history, Medicaid denial letters, asset tests, or net worth tests when determining eligibility for individuals and families with annual incomes at or below the 200% of the most current federal poverty guidelines. So I won't go through this whole sliding fee discount policy example. Again, it's found in the Appendix C of the site reference guide, or pages 49, 52 of the NHSC site reference guide. But again, having those requirements that we talked about in the previous slide for your policy. Policies, again, this example is only about 4 pages long. You don't have to have a long policy, especially because people are reviewing your application. They are going to look through, if it's a 60-page document, they're going to look through every page. So that takes more time. And of course, the applicants or the reviewers reviewing your application. So definitely keep that in mind. It's not to say you can't submit, a 60-page policy if that's your, organization's policy, but making sure it has all those requirements. But sometimes extra wording can also trip some applicants up and some sites up too. So trying to make it as concise as possible and clear too is the best way to really making sure you do get approved to be an NHSC site. So this is a sliding fee discount application example too, found in the reference guide. So it talks about, it's the policy of ABC Healthcare to provide essential services regarding the patient's ability to pay. ABC Healthcare offers discounts based on family size and annual income. So then they fill out their name, their address, any household members, including those under the age of 18. So write their name. They don't need to know marital status, things of, again, that nature that we discussed, and then sources. So gross wages, salaries, tips, etc., income from business and self-employment, unemployment compensation, workers' compensation, social security, income, veterans payments, survivor benefits, pension or retirement income, and then interest, dividends, royalties, income from rental properties, estates and trusts, alimony, child support, assistance from outside the household, and any other miscellaneous sources. So that's the only source of income you can have on your sliding fee discount application. Again, if you had any of those other ones that I talked about, like Medicare, social security numbers, citizenship status, anything like that, you will be denied for the NHSC site application. So making sure your sliding fee discount application has only those required items and nothing more, and then a place for them to sign and date, and then an office use sign, of course, too. So who submits the SFS policies and application? So exempt facilities, again, will be your FQHCs, those FQHC lookalikes, Indian Health Service facilities, federal and state prisons, ICE facilities, and free clinics. So I have asterisks for these ones, though, because they might be requested, again, with an NHSC site visit or upon any time of other requests from HRSA. So definitely have to have some documentation of if your facility doesn't charge, again, going back to a free clinic, doesn't charge, there still needs to be some documentation that says, we do not charge patients for our services or that. So it has to be some type of documentation, even if these sites don't have to submit it, definitely need to have it somewhere within that organization or facility. But if your facility does not fall under those exempt facilities, then you must submit the policy and the application for the NHSC site application. And for all other questions, feel free to email me.